Everything is a public health crisis these days. Racism, climate change, inaccessible gender-affirming health care. But there's one actual public health crisis the left loves to ignore: diversity, equity, and inclusion. This sick cancer has infiltrated our medical schools, our doctors, and our health care. Tonight, I'll show you it's only a matter of time before wokeism begins to actually kill. Hello, America. This has been something that has been on my mind and my heart for quite some time, and this is the first show on it. I know we will be returning to this topic in the coming days, especially if no one does anything about it. If there is one area of life you would hope might be off limits to the left-wing, progressive, Marxist insanity that is ripping through the nation like wildfire, surely it would be the field of medicine. When it comes to your health, politics should not have anything to do with how you're treated by your doctor. And yet, listen to the kind of lecture that first-year medical students at UCLA are now required to attend, least recently as part of their mandatory course on structural racism. This is a guest speaker saying a prayer to the ancestors and Mama Earth.
Thank you to all of our relatives who die on these occupied streets every day. Our black and brown and poor people, houseless people from all nations and all generations who die because of the capitalist lie of scarcity, of private property, of money and ownership of Mama Earth, when Mama Earth was never meant to be bought or sold, pimped or played. And finally, thank you to Mama Earth, who we poison from and extract from and take from every day, but is still here.
Wow, that sounds like fun. That guest speaker had the students get on their knees and touch Mama Earth with their fists while she prayed. Then later, according to a report in the Free Beacon, she led the students in chanting "Free, Free Palestine." Good times were had by all. Well, I mean, unless you happen to be a Jewish student in that class. But don't worry. 8,000 years of civilization, we had a good run. Why not flush it down the old crapper? In February, Dante King, a guest faculty member of the University of California at San Francisco School of Medicine, delivered a lecture titled "Diagnosing Whiteness and Anti-Blackness: White Psychopathology, Collective Psychosis and Trauma in America." Now, King says that white people are racist because they're genetically predisposed to psychopathy.
The historical record has well documented white people's narcissistic personality disorder and insecurities, along with their internalized distortions, fear, and perversions about African people. In their relationship with the Black race, whites are psychopaths, and their behavior represents an underlying biologically transmitted proclivity with roots deep in their evolutionary history. How many of you could see the proclivity that evolved deep within the evolutionary history of whiteness by show of hands? How many of you could see it? Some people are sitting here, oh no, I don't want to raise my hand. Yeah. That's called denial.
Oh my. Love that. Now, what any of that has to do with learning, how to open up a body up and, hey, which one's the gallbladder? Is any common sense person's wild guess. But unfortunately for America's medical future, this kind of left-wing propaganda is fast becoming the rule rather than the exception. Top-ranked Harvard Medical School has activist courses like social change and the practice of medicine. They're teaching it to aspiring doctors how to be important advocates for social change. Well, at George Washington University School of Medicine, students take courses in how to talk race, power, and privilege in classroom and clinical settings. I got to tell you, my doctor might need another doctor, probably a nose doctor, if I went in and just wanted him to, and he started telling me about white privilege. I'm just saying. Moving beyond bystanding to disrupting racism. Yes, that's what they're learning. And the ever-popular Beyond the Binary, Navigating Pregnancy and Affirming Care for People with Diverse Gender Identities. There's also Confronting U.S. History. We Must End Racism to End Health Disparities. That course included a webinar session with Nicole Hannah-Jones, the creator of that complete fiction, 1619 Project. Because if all of our doctors hate America, it'll make the patients healthier, right? See how that works? At the Indiana University School of Medicine, first-year students in basic anatomy classes are taught that gender is a social construct, that sex and gender fall along a continuum rather than being a binary. And it calls the man and women gender types oversimplifications. I don't know about you, but when all these people graduate, I don't ever want them on my list of doctors to go see. Problem is, it'll be all the doctors. These are real classes. Many of them are required at leading medical schools in the United States of America. According to Do No Harm, this is an organization that was actually started to expose and combat all of this insanity. 23 of America's top 25 medical schools now have anti-racism instruction as the core part of their curriculum. By the way, the founder of Do No Harm, Dr. Stanley Goldfarb, joining me tonight, a little later on in the program. Mix up a drink, kick back, and enjoy. The one UCLA medical student that spoke to Fox News last month and the left-wing ideology said, quote, left-wing ideology is laced through all 4 years of medical school. The student explained, quote, I would say there's not any room for pushback. It's more framed as if this is the reality of medicine or this is the reality of our society. And then the discussion is, what can we do about it? But it's not a discussion of whether the premise or anything other than the is objective fact. That's great. Yeah. And the sun still goes around the earth. Does, really. UCLA medical students are asked to participate in climate activism, including going to a big oil resistance event. Pressuring state legislatures also to support a climate bill and helping researchers at UCLA study the environmental injustices of the prison industrial complex. This movement goes beyond medical schools rebooting their curriculum or even having a few activist classes. The New York University the State University of New York, upstate, the medical university in Syracuse. It's been around since 1834, put out a few good doctors. But they've put together a diversity task force. It's kind of like the A-Team that produced a 164-page report demanding action like this, quote, healthcare professionals must explicitly acknowledge that race and racism are the root of these health disparities. Their report also requires all students and staff to be trained in bystander intervention for bias. I don't even know what that is. But then again, I don't know how to remove a heart and put a pig's heart in it. So what do I know? All these new faculty members are required to sign a pledge affirming their commitment to diversity, equity, and inclusion. Jawohl! Christopher Rufo reported on the oath that medical students at the University of Minnesota now must take. It includes a pledge to, and I quote, honor all indigenous ways of healing that have been historically marginalized by Western medicine, fight white supremacy, colonialism, and gender binary. Amen, brother. Who doesn't want their doctor saying those things? Now, I wonder, does this indoctrination create a greater passion for activism or for becoming a better, more dedicated doctor that does know how to put a pig heart in me? No offense to Muslims. In 2022, or Jews, may I say, that's a double whammy. A Wake Forest medical student was about to draw blood from a patient who made an apparently mocking comment about pronouns, the pin that this female student was wearing. The medical student then retaliated by missing the patient's vein on purpose, so she had to stick the patient twice. But then it gets really good. Then the student bragged about what she had done in a tweet. After some backlash, Wake Forest eventually placed her on extended leave. Science is no longer at the helm of American medical schools. It has been replaced with the DEI obsession. In 2022, President of the American Association of Medical Colleges said, and I quote, "We believe this topic, diversity, equity, and inclusion, deserves just as much attention from learners and educators at every stage of their career as the latest scientific breakthroughs." Wow. I'd rather have them pay attention to the latest scientific breakthroughs that actually will mean something to me. And I don't care what color I am or the doctor is. DEI is just as important for medical doctors as following science. By the way, the organization he heads, the American Association of Medical Colleges, the AAMC, in partnership with the American Medical Association. They form the accrediting body for the U.S. schools, for U.S. medical schools in the U.S. In fact, in 2022, the AAMC released its DEI competencies report, which spells out that the DEI propaganda that medical schools are expected to incorporate in their training of doctors. This unquestioning devotion to DEI now governs admission standards at medical school. Now, I don't know about you. There's a couple of people. I want the one that was the brightest in their class. That would be the guy who flies the airplane. Dare I say, even the woman. Oh, that's so progressive. I want the best one flying the airplane. I want the person that's sticking their hands in my chest. I want them to be the smartest person in class. I don't care what color, what gender. Well, I don't necessarily want to wake up in the middle of the operation, which has happened to me twice, but that's a different story. Wake up and then see some guy dressed as a woman, with too much rouge on. It would be disturbing. I'm just saying, unless they're the best qualified person. Now, the AAMC now discourages schools from using the MCAT admissions test as a way to select medical students. Dozens of schools have made the MCAT optional. The University of Pennsylvania, an Ivy League school, now has guaranteed admission with no MCAT required for black students who meet GPA and internship requirements. They also get a 50% discount on tuition. That's great. Everybody wins, except the patient. The MCAT itself has been altered to try to create more equity in admissions. 1/4 of the questions are now about social issues and psychology. As part of broadening the administrative process or the admission process beyond a student's aptitude for actually becoming a doctor, most med school applications now have DEI questions. Good old-fashioned litmus test to see if you follow the orthodoxy. You know what I mean? Hey, how much you love Hitler? Never mind if you're a scientific genius. If you're opposed in any way, if you don't believe in 99 different genders, do you support the stance that racism is a public health crisis? Not so much. No. You're out. One doctor writing recently in the Wall Street Journal says, quote, "I assume most people don't know how politicized their selection and training of their future physicians has become. Even I, as a physician, was unaware until my son went through medical school, the application process. Nearly all of the schools requested multiple essays providing a detailed explanation of the applicant's dedication to DEI and participating in DEI-related activism. Some schools had essays querying the applicant's activism for or opinion of progressive border policies." Doc, you have a finger up my butt right now. That's all I want to hear from you, is how soon you're going to get that finger out of my butt and that everything in there is okay. I don't want to hear your view on the border. Otherwise, you might have a shoe up your butt. Most also requested that students discuss how they have been adversely affected by systemic racism. And if they haven't been affected, then they should discuss what plan they do have to fight systemic racism anyway. The worship of DEI has now even made the step one federal licensing exam, which is taken at the end of the year of medical school, a pass-fail exam. I don't know, heartbeats. Is it multiple choice? The one-step exam is usually the biggest decider in selecting applicants for residency in programs. But now, numbered scores are not allowed because lower average scores are keeping minorities from getting into competitive residencies. Because you don't want the best and brightest students, becoming heart surgeons, you need somebody who understands equity, that demands equity first and foremost. Heart surgeons, I need to see your skin color palette, okay? What Pantone number is your face? Back in a minute with the causes and consequences of this insanity, and has it ever happened before in history? Next. Who's got a headache, right? Who has a body full of pain? I know when I do this show, the pain is mostly coming from behind me, you know what I'm saying? But nothing will stop that pain except the possibility of an election. Living with pain is no joke, the kind of thing that can ruin your life if you just can't get out of pain. I want to talk to you about Relief Factor. Relief Factor is the daily supplement that helps your body fight pain by fighting inflammation. 100% drug-free, developed by doctors to help reduce or eliminate pain. Over 1 million people have tried Relief Factor's Quick Start Kit. 70% of them have gone on to order more. So see how Relief Factor can help you. Get their 3-week Quick Start. It's $19.95, comes with Relief Factor's Feel Better, Your Money Back guarantee. So give it a try. Visit relieffactor.com or call 800, the number 4-RELIEF. That's 1-800, the number 4-RELIEF. When you feel the difference, you'll know it works. I don't know why that guy on TV is making such a big deal out of it. It's just all they're doing is they're just saying these things so they can pass. I mean, nobody believes in any of this stuff. So why don't they just say it, and then they'll learn all that doctor stuff as well, and they can become a doctor. Well, let me tell you, I am a doctor, but I don't play one on TV. The DEI virus that's infecting our medical schools, it will tell those doctors, you may not say that, you may just say that now and pretend you don't believe it, but eventually you keep saying it enough and you will believe it. And if you don't have the balls at school when you're paying those pinheads, remember, they're not paying you, you're paying them hundreds of thousands of dollars. If you don't have the balls to stand up to them when you're paying them, when the situation is reversed and somebody's paying you, are you going to have the balls to say to them, that's ridiculous? You're a man or a woman of science. You're not a little Bambi wood elf. You're a human being, either male or female. No spectrum. In a relatively short period of time, this has spread throughout the entire medical establishment. Many state medical boards now require additional training hours in things like anti-racism, implicit bias for doctors to maintain their medical license. You think you're gonna roll the dice once you have the MD? No, now you have a whole career and medical school, all of those bills to pay for. Unless you could get Joe Biden to give you the money for those bills, then it's all candy canes and lollipops. The New England Journal of Medicine features an ongoing race and medicine series to combat racism as the public health crisis. And yet somehow the strategy to fight this health crisis involves segregation of medical students. According to this journal article last year, they're not segregating, okay? It's not segregation. They call it racial affinity group caucusing. What a pile of horse crap. In 2021, the American Medical Association, which is the nation's largest professional organization of doctors, released its organizational strategic plan to embed racial justice and advance health equity. The plan begins out by saying, and I quote, "We acknowledge that we are living off taken ancestral lands of indigenous peoples for thousands of years, yada, yada, yada." The AMA requires, quote, "an unwavering commitment to equity and comprehensive strategy for embedding racial and social justice within our organization and domains of influence." Clearly, their strategy is working. DEI doctrine is thoroughly embedded all across America's medical profession. The AMA report might just as well been co-authored by the Democratic National Committee, since the report references police brutality, deliberate and ongoing family separation at the U.S. border, persistent gun violence, structural racism, endangerment of the transgender community, and reproductive justice. It's no surprise that researchers at Stanford University found that in the past 20 years, doctors have gone from being 60% Republican to 80% Democrat. So what's caused this obsession with DEI across the medical field in recent years? Well, one major factor is Joe Biden. On his first day in office as president, he issued an executive order on advancing racial equity. This made rooting out alleged systemic racism an urgent priority for the entire federal government. Under Biden's order, federal agencies were required to develop equity action plans to level the playing field. As an example, and as a result, the Department of Health and Human Services announced that it would pay higher Medicare reimbursement rates to doctors who, quote, create and implement an anti-racism plan. Now, this is based on their acknowledgement that systematic racism is the root cause for differences in health outcomes between socially defined racial groups. All you have to do, you develop a little plan, that's it. And then maybe you have a nice little practice here. It would be so bad if something happened to it. You know what I'm saying? All you have to do is just come up with a little plan, and we give you money. What? Yes, you did hear right. Bonus Medicare payments for doctors who bow down to the left-wing Biden golden idol of DEI. For any entity seeking federal dollars, DEI is lucrative business to be in. Another root cause of DEI and the tidal wave in medicine was the George Floyd Black Lives Matter rioting in 2020. All manner of businesses and institutions tripped over themselves trying to prove just how anti-racist they really are in the aftermath of the chaos. No, we're going to give more. Our box is more black than your box on Instagram. Within 2 years after the riots, over 260 county, city, state governments, government agencies declared racism a public health crisis. In that environment, a medical students group called White Coats for Black Lives grew exponentially. It now has 75 chapters at medical schools across the nation. Their mission is to dismantle racism in healthcare. For this group, treating patients is secondary to social activism. Their priorities include, and I quote, abolishing prisons and policing, dismantling capitalism, decriminalizing drug use. I know all the doctors I've ever seen, they're like, you know what? You should have more drugs in your life. Decriminalizing sex work, dissolving the oil and gas industries, and unless he's a GI specialist, that's the only gas I want to hear my doctor talk about. Removing all obstacles to gender-affirming health care. Wow. You don't have to be full, queer, trans liberation. That's great. And, of course, universal access to abortion. Weird coincidences you may have noticed. Once again, all these priorities just happen to dovetail nicely with the Democratic Party priorities. They should have like little red pins they could wear here. Show what party they're part of. White Coats for Black Lives also has no shortage of statements against, quote, Israeli apartheid. They even offer medical apartheid under the Israeli Regime Resource Guide. They have also produced a racial justice report card in which they grade top U.S. medical students or schools for how thoroughly they're incorporating DEI priorities. We want to be all in. We're going to sing the songs. We're going to wear the outfits. We're going to be good little DEI students. One of their metrics for making the report card is making sure that, quote, the medical school conducts no joint research endeavors with Israeli academic institutions or corporations. Because I got to tell you, when you look at the Jews, there's nothing but a long history of dummies there. There's just not a scientific mind amongst all of them. Now, in a normal world, which we are definitely not in today, you might be able to dismiss the musings of quasi-Marxist organizations like this, except medical schools are caving into the demands of White Coats for Black Lives. The Association of American Medical Colleges has urged schools to develop their own report cards, similar to the ones created by White Coats for Black Lives. Remember, oh man, I would love to run one of these institutions. Give it to me for a week and I could fix all this. Remember, the AAMC, along with the American Medical Association, is in charge of accreditation for these schools. Now, if medical schools resist these DEI demands, they could risk losing their accreditation. But who accreditates them? Where do they get their accreditation? I mean, gosh, if we only knew. So what are the consequences for these people who would dare resist this movement? Dr. Richard Bosshart wrote an opinion piece in the Wall Street Journal criticizing how the American College of Surgeons was prioritizing critical race theory. He was kicked out of the organization. He'd been a member for 30 years, but enough of him, I'll tell you that right now. In 2021, Dr. Edward Livingston, deputy editor of the Journal of American Medical Association, went on the journal's podcast and argued that doctors and the medical field in general are not racist. He reportedly said, and I quote, "Many people like myself are offended by the implication that we're somehow racist. The focus must be on equal opportunity and make sure that that exists." Please tell me we beheaded him, right? And his children. Now, I say he reportedly said that because once his comment circulated on social media, the Journal of the AMA quickly disappeared the podcast episode. Dr. Livingston resigned. It was all his choice, really. And for good measure, the journal's editor-in-chief was forced to resign as well. Even minorities can get canceled if they don't toe the line. In 2020, Dr. Norman Wang, a cardiologist, a cardiologist and associate professor at the university. All my credibility has really gone away right now. Like I had any in the first place. University of Pittsburgh Medical Center wrote a paper questioning the effectiveness of affirmative action in medicine. Once again, the backlash was swift. The Journal of American Heart Association retracted the article, even though it had been peer-reviewed. His university demoted him and barred him from contact with medical students. His crime? Well, he reached the wrong conclusion in his paper that cardiologists should be, and I quote, assessed as individuals on the basis of their personal merits, not their racial or ethnic identities. You want that guy operating on you? Not me. The DEI orthodoxy even filtered down to medical contracting. In my own backyard here in North Texas, a public hospital system, JPH Health, gives more weight to diversity and inclusion when evaluating contracts for medical equipment and their services. In one of their bids, diversity and inclusion is worth 5 more points than the reputation of a vendor's goods or services. So it doesn't matter. My medical product, I made it out of waste pipe and toilet paper wrappers, and I got some chewing gum here, but it's going to be good because we're all fill in the blank, anything other than white, straight, or religious. The greatest consequence of the DEI craze in medicine is that it puts patients at risk. When the Food and Drug Administration issued its guidelines for allocating certain COVID treatment drugs, they listed race as one of the factors that would categorize a patient as high risk. Many states use the FDA guidelines to prioritize racial minorities for COVID treatments. For example, the Minnesota Department of Health plan states, quote, FDA's acknowledgement means that race and ethnicity alone, apart from other underlying health conditions, may be considered in determining eligibility for monoclonal antibodies. It is ethically appropriate to consider race and ethnicity in monoclonal antibody eligibility decisions. Last year in Portland, Oregon, a woman who was undergoing treatment for breast cancer wrote an email to a doctor at the Richmond Family Medicine Clinic objecting to the transgender flag display inside the clinic's waiting room. As a result, she received official notice that she was discharged from receiving medical care. But not only at her clinic, but all the other clinics in the Oregon Health Science University network. What about your Hippocratic oath? This is the left's equity at work. Fanatically religious devotion to anti-discrimination unless you object to any aspect of their tyrannical program, then their discrimination is turned right directly onto you. Quick break. Warning from medical history. A little later, I'm going to be joined by Dr. Stanley Goldfarb, who is fighting against this madness, and he could use your support and help. You know, when all crap hits the fan, don't worry. Don't worry, all this DEI stuff, all this, well, are you white, you Christian, or are you transgender, and been, dissed by white people so often. None of that is going to play into who gets help and who doesn't. May I suggest, I don't care what color you are, it is your responsibility to be secure in yourself, your home, your family, to be able to sustain yourself at least for a while. I want you to secure some supplies just to be ready, just in case something bad happens. MyPatriotSupply.com. Start with a 4-week emergency food kit from My Patriot Supply, helping millions of families prepare since 2008. My Patriot Supply are experts in all things self-reliance. They have a 4-week emergency food kit right now, offers 2,000 calories every single day. It's protected by a heavy-duty 4-layer packaging, and the kits last up to 25 years in storage. They're really yummy, I know, because I've eaten some of them. I mean, we've got like 24 and a half years worth of food. The delicious foods are sealed inside rugged buckets with handles designed to grab in a hurry. So do it now. Go to MyPatriotSupply.com. Get as many food kits as your family needs for $50 off each. They ship fast and free in unmarked boxes. Save $50 per kit at MyPatriotSupply.com. That's special going on now, MyPatriotSupply.com. We already have the worst case scenario from history when it comes to abusing cutting-edge so-called science and medicine. This, of course, the Nazis and the Holocaust. Now, I'm not equating the current DEI takeover of medicine with Nazism, but while they're not the same thing, they're on the same train system. Okay, just how far does this one go? We're seeing some dangerous footholds that can lead to horrible things. When state health agencies prioritize life-saving treatments based on race, for example, or when a medical school professor lectures on the genetic basis of psychopathic racism in white people, these can be and will be in time just footholds that lead a healthy society to no place good. We're not a healthy society. Dangerous footholds based in rational science is how Nazi horrors began. They argued they were just following the science. Well, the scientists at the time and the science of that time was called eugenics. Ultimately, it argued for the ridding of society of certain groups of people. It was largely developed and promoted for a couple of decades in America, long before the Nazis took this science over to its logical conclusion. Charles Davenport was one of the main leaders of the eugenics movement in the U.S. He ran the Eugenics Records Office, which promoted this pseudoscience into the American public. In 1911, he wrote an influential book called Heredity in Relation to Eugenics. Essentially, Davenport argued for the government control of human reproduction through sterilization and even killing of undesirables as an option, writing, quote, "Through capital punishment, a crude method of grappling with the difficulty is infinitely superior than that of training the feeble-minded and criminalistic and letting them loose upon our society and permitting them to perpetuate their offspring in these animal traits." Now, it sounds horrible to all of us now, but it didn't to the early American progressive. Later, he wrote, "The Commonwealth is greater than any individual in it. Hence, the rights of society over life, reproduction, the behavior and traits of the individuals that compose it are limitless. And society may take life, may sterilize, may segregate as to prevent marriage, and may restrict liberty in 100 different ways." With that extreme rhetoric like that, Davenport's book was used in medical schools all across the U.S. You can trace the rising tragedy of eugenics movement through the presidents of the International Federation of Eugenic Organizations. It started with a British president, appropriate since England was where eugenics first gained a foothold. Then the American Charles Davenport was president from 1927 to 32, appropriate since 41 states passed eugenics laws and 65,000 Americans were eventually sterilized. Then Davenport was succeeded as president by Ernst Rudin, who helped create one of the first laws passed when Hitler came to power, the German sterilization law. In 6 years, the first 6 years, 400,000 Germans had been sterilized. The Holocaust might not have happened without the full support of the German medical establishment. I'm telling you right now, the scariest uniforms were not the black ones with the black boots. They were white coats. By 1933, over half of German medical professionals had joined the Nazi Party. They created the National Socialist German Physician League, which united the goals of doctors with those of the Nazi state. One historian notes that doctors, quote, became Nazified more thoroughly and sooner than any other profession. As the Nazis, they did more in the service of the nefarious regime than any of their extra-professional peers. By 1942, 38,000 German doctors were Nazi Party members. They were so committed to treating the so-called racial sickness that they insisted was contaminating the body of the German people. 6 years into Hitler's reign, the sterilization program graduated to euthanasia, what the Nazis deemed mercy killings of the sick and disabled. They started with children up to 4, usually killed by starvation and poisoning, but then they followed the science. This is the last prescription written by Dr. Mengele. It was written for the Children's Hospital, and he here is ordering his signature, 100 liters. 100 liters of luminol, which is enough to kill about 100,000 adults. He was sending that to the Children's Hospital. The program then expanded to teens and eventually adults in mental hospitals. Nazis expanded their definition of handicap. First, it was disease and deformity, but it gradually encompassed things like being a slow learner or a chronic bedwetter. The victims were bused to killing centers by SS officers dressed in white doctor uniforms. Conservative estimates are more than 10,000 German children and teens were murdered under this program, and at least 70,000 adults. And this horror was just dress rehearsal for expanding their racial hygiene project to the rest of Europe with the murder of 6 million Jews. This is all the result of science and medicine and doctors reinforcing and justifying the state's ideology. You think doctors were good guys? This is the head of the German Red Cross. You know who he was? You know what he did? Look at the Red Cross symbol right here for the Germans. He was just the guy who said how much Zyklon B needed to be put in. And the scientists were happy to help. This, signed by Adolf Hitler, is an award given to the IG Farber company. They made the gas that this doctor told them how to kill a number of Jews in every gas chamber. This is signed by Adolf Hitler. This is the promotion of the guy who was in charge of all the death camps, everything, a surgeon. This was his honor to receive this as the head of the medical doctors. Doctors can be lifesavers. Doctors can be monsters. In 2018, the American Journal of Public Health published an academic article written by a medical doctor and two professors titled The Nazi Physicians as Leaders in Eugenics and Euthanasia, Lessons for Today. They write, quote, a series of recurrent themes arose in Nazi medicine as physicians undertook the mission of cleansing the state. In light of what you've seen tonight about the DEI takeover of medicine, how closely it aligns to one party's philosophy. See if anything familiar from these themes. Ready? The devaluation and dehumanization of segments of the community. Check. The medicalization of social and political programs. Check. The training of physicians to identify the political goals of the government. Definite check. Fear of consequences of refusing to cooperate with civil authority. Check. Bureaucratization of the medical role. Check. The lack of concern for medical ethics and human rights. Check. I'm not warning you. Those who have been slaughtered by dangerous doctors with dangerous ideologies cry out to you. These are dangerous footholds. Be right back with the solution. The founder of Do No Harm, Dr. Stanley Goldfarb, next. Joining me now is Dr. Stanley Goldfarb. He is the founder and and chairman of the board of an organization called Do No Harm, which represents doctors, nurses, medical students, and patients working to get identity politics out of medicine. Dr. Goldfarb was longtime professor of medicine at the Perelman School of Medicine at the University of Pennsylvania. He has published more than 100 articles in the New England Journal of Medicine and other top medical journals. He is also the author of the 2022 book, Take Two Aspirin and Call Me By My Pronouns, Why Doctors Who Are Into Social Justice Warriors is Destroying American Medicine. It's a call to action against the DEI threats to the medical education and healthcare in the U.S. Dr. Goldfarb, thank you so much. Some people who will watch tonight's show will say this is no big deal. People are just going along to get along, and this isn't going to pose any kind of harm to anybody. What do you say to them?
Well, it's very good to be with you.
Thank you.
No, I think there's a great deal of harm here, and in several ways. The first way is that the DEI enterprise has led to a dramatic lowering of the standards for who gets into medical school and then who gets promoted in the faculties of in medicine. And this is a terrible sort of situation, because really what patients want, of course, is the best and the brightest physicians that are available to take care of them, not someone who's there because of some desire for an affirmative action. And medical schools, despite the Supreme Court's ruling about the Students for Fair Admissions, are looking for ways around this and continue to try to focus on getting diversity as the main issue in their medical school classes and goal of the medical school admissions process, rather than the best and the brightest. So that's one way. The other way is that it just promotes incredible divisiveness in healthcare. there's a real move afoot. As the rationale for diversity in the healthcare workforce is that Black patients need Black doctors, frankly, so-called racial concordance. Our organization has done the research on this. There are over 60 studies of this in the medical literature, and they've been summarized in a number of studies, in 5 studies. And the bottom line is that there really is no benefit at all to having someone of a particular color taking care of you.
Yeah.
Communication isn't better, and certainly there's no evidence that outcomes are better. So
it's funny to me. It seems as though this is exactly what the progressives worked to get away from in the late 1800s, early 1900s, and now we're coming back to it. I'm concerned that a lot of the stuff that's being taught seems to be a violation of the Hippocratic Oath.
Well, certainly. The idea is that we should treat everybody as an individual and not treat them based on any group characteristics. The only way we should pay any attention to that is if it impinges on their medical care. You know, for example, there are certain diseases that track with certain racial groups. That's what we need to pay attention to. But this idea that we should treat people in a certain way because of their skin color is ridiculous. Black patients want the best doctors that are available, want the best outcomes. That's what they want. And having a particular racial characteristic of your physician is not going to achieve a better health outcome.
So
we know that.
What does your organization need to turn the tide, assuming that it's not too late to turn the tide? How can people help you?
Well, they can join us. There's no cost to joining us. DoNoHarmMedicine.org. And the basis for them joining us, it gives us 2 opportunities. One is we're, as a member organization, if someone identifies something that really is requires some legal action, we can sue on their behalf and maintain their anonymity. And this has led us to a number of lawsuits that we've been able to prosecute, and some quite successfully, including against the federal government even, and against important medical organizations such as Pfizer, that we've sued also when they had discriminatory practices. So that's the best thing they can do for us. The other thing is that, you know, we're involved in several legislative efforts around the country to get rid of DEI in healthcare, and Representative Greg Murphy, who's the representative from the eastern part of North Carolina, has sponsored a bill now in Congress that we've helped and worked closely with him on to get DEI out of medical schools, to have no need for loyalty oaths signed by physicians, and to have the DEI offices closed down and stop wasting money on this racist kind of nonsense that's really promoted by them.
Dr. Goldfarb, thank you so much. I wish we had more time with you. The website, and I urge you to go and read all about it. Do your own homework on this. And if you feel it's right for you to join, DoNoHarmMedicine.org. That's DoNoHarmMedicine.org. Dr. Goldfarb, thank you so much. Final note, this is something that I have been worried about for a very, very long time. If you've watched me and have seen my record of being at least in the right direction, please do not dismiss this episode. Good night.